Hi class, my name is Alejandra Tellez. Today is October 26th and I will be presenting about ulcerative colitis. A typical patient presentation. Mrs. Jones is a 32-year-old woman who presents with abdominal pain, hematochezia, which is bloody diarrhea, and feeling very tired. These symptoms began 2 months ago and she has noticed a loss of weight. She is currently busy and stressed planning her wedding. At her doctor's visit, she explains she goes to the bathroom more than 4 times a day, which is only a small amount of stool. Her diet consists of high fat and low fiber and has not made a change to it. What is ulcerative colitis? We can take its two words and break down the meanings. First, we have ulcerative, which just simply means ulcerations, and then we have colitis, which is the inflammation of the colon. The definition states that it is an inflammatory bowel disease that causes inflammation and ulcers in the digestive tract. It involves the innermost lining of the large intestine and rectum. It is limited to the large intestines, which is the colon and the rectum. For the etiology, we have that the cause is idiopathic, meaning that it is unknown, but there are a couple of factors that do play into the cause of ulcerative colitis. First, we have environmental sources that are not the cause but may trigger it, such as smoking, obesity, physical inactivity, and a Western type of diet, which just means that there is a high intake of saturated fat and a low intake of fruits, vegetables, and fiber. Another one is genetic factors that are passed down from one parent. And we also have that it could be an autoimmune disorder, that cytotoxic T cells are found in the epithelium lining of the colon, which we will get more into that. A little more background information on ulcerative colitis is that it was first discovered in 1875 by two English physicians named Wilkes and Moxon. The number of cases is 12.2 per 100,000 people, or approximately 38,000 new cases per year. There are about 907,000 Americans that currently have ulcerative colitis. 48% of those people are in remission, 30% have mild activity, 20% have moderate activity, and about 1 to 2 have severe activity. Some of the risk factors include family history. It affects men and women equally. Ages 15 to 35, but it is more common in women. It also affects Caucasians primarily and Eastern European Jews. Before we get into the pathophysiology of ulcerative colitis, I do want to remind you to take a look at the normal physiology and function of the large intestine. That includes the rectum, the sphygmoid colon, descending colon, transverse colon, ascending colon, and appendix. Some of its normal functions include absorption of water and electrolytes. Healthy gut bacteria aid in digestion and make certain vitamins. Temporary storage of feces, and the elimination of waste from the body. The pathophysiology of ulcerative colitis begins with a flare-up in the large intestine, followed by small erosions that form and they turn into ulcers. On the picture on top, we can see a normal colon, and on the right, we see what a colon with ulcerative colitis has, and all the white patches are the ulcerations, followed by mucosal destruction causing bleeding, cramping, and urge to eliminate waste. The pictures on the bottom show the lining of the colon, and as you can see on the left, there's nothing wrong with the lining. It is completely fine. And then on the right, we have the eroded area. And then we have large volumes of watery diarrhea due to the loss of absorptive surface of the mucosa. It is also believed that ulcerative colitis can be an autoimmune condition. First, we have that the cytotoxin T cells are present at the epithelium lining of the colon, indicating inflammation and ulceration. This destroys the lining of the walls and leaves behind eroded areas slash ulcers, as you can see in the pictures. The second reason can be that the immune system mistakes friendly bacteria in the colon as a harmful infection. The third cause can be that a viral or bacterial infection triggers the immune system but does not turn off once the infection has passed and continues to cause inflammation. The symptoms that are present in ulcerative colitis include increased watery bowel movements, hematochezia, which is bloody stool. We also have dehydration because the water can't be absorbed, so the colon lets too much water out. We also have pain in the left lower abdomen. There are also systemic symptoms, which include fatigue, fever, loss of weight and appetite, nausea, and anemia due to chronic bleeding from the inflamed and ulcerated tissue that cause a shortage of red blood cells. Here we have more symptoms that are extraintestinal manifestations, and between 20 to 40% of IBD patients experience EMIs, which are diseases that affect other parts of the body, commonly in the joints, skin, bones, eyes, kidneys, and liver. For the bones, 30 to 60% have decrease in bone density due to prolonged use of corticosteroids or active inflammation. For the eyes, 10% of patients experience eye problems such as dry eyes. And for the skin, 20% experience skin complications. Most common is to the picture on your left. Erythema nodosum, which are painful bumps that are under the skin. For the types of ulcerative colitis, we have proctitis, which affects the rectum and it is a mild case. We have proctosphygmoides, which affects the rectum and the sphygmoid. Then we have distal colitis, which affects the rectum, sphygmoid, and descending colon. And then we have pancolitis, which affects the whole colon and rectum, and it is the most severe. Complications of ulcerative colitis include perforated bowel, which is a chronic inflammation of the intestine that may weaken the intestinal wall, such to an extent that a hole develops, allowing stool to leak into the abdomen, which can cause a life-threatening infection. And as you can see on the picture on the right, it shows the colon and that the wall has thinned out so much from the inflammation that the stool begins to leak out. We also have a toxic megacolon, and it is a rapid enlargement of the colon, and it is from severe inflammation. As you can see the picture on the left, the colon is so enlarged from the inflammation. Another complication is dehydration, and it is because of the lining of the colon can't absorb fluids. The extra water exits the body in watery bowel movements. We also have anemia. 1 in 3 patients experience this due to the colon's inability to absorb iron and the blood loss from the intestinal bleeding. And lastly, another complication we have is colon cancer. And chronic inflammation leads to this cancer. 2% is at risk after 10 years, 8% after 20 years, 18% after 30 years of the disease. In the diagnosis, we have the colonoscopy, which is a long tube with a camera that is inserted through the anus to see the ulcers, and take a biopsy, which is a tiny tissue sample that is taken for analysis, and this is the best way to confirm for ulcerative colitis. In the picture, we can see that disease progresses and the hostia of the colon becomes smooth. The white patches indicate ulcers. Lastly, active inflammation leads to chronic bleeding, as we can see in the severe inflammation to the picture on the right. We also have the barium enema, which is an examination that shows loss of the haustral folds in the entire descending colon with small insertions, along with a lead pipe appearance, and it is an injection of liquid into the rectum, resulting a clear image of the colon. For the treatments, we have to understand that ulcerative colitis is a chronic, lifelong condition that can be treated but not cured. There are periods of remission where the tissue heals and can last months or years without a flare up. It depends on the severity of symptoms. First, we have anti inflammatory medication that is used on mild to moderate cases, and this helps to reduce inflammation. Then we have immunosuppressors that are used for moderate to severe cases that reduce the activity of the immune system and help to treat mild to moderate flare ups or maintain remission. Lastly, we have a colectomy, which allows to experience fewer flare ups and complication, and it is only used for the if the treatment fails, and it is usually considered a last resort for ulcerative colitis. These are the references that I use to make my presentation. Thank you for listening all the way till the end, and if you have any questions, feel free to send me an email. I have left it down below. Thank you.